Good morning, afternoon, evening to everybody from wherever you're joining, and thank you for joining us today. We are very delighted and happy to have you for what promises to be quite a very engaging and informative session on the interlinkage between climate change and AMR and the request for proposal that has just been released. Together with me here from ICARS is our Science Director, Dr. Christina Osbier, and also my colleagues Celia and Vanessa that will be supporting and guiding and providing feedback throughout the course of this webinar. My name is Sunday Ochonwochai. I'm a science advisor here at ICARS, particularly focusing on climate change and AMR. Here are some very basic housekeeping things that we should take note of. First, your microphones are automatically muted to ensure clear audio for all participants. And please, we ask that you use the chat function for conversations, and also they will have dedicated Q&A function for you to drop all your questions. And just to inform you also that we'll have a dedicated Q&A session at the end, but feel free to submit questions anytime in the course of the presentations and discussions. And also to note is that this session is going to be recorded and we'll be sharing with all registered participants at the end of this session. With this, I would like to welcome our Science Director, Christina Osbier, to start with this webinar. Over to you, Christina.
Thanks a lot, Sandy, and a warm welcome to everyone participating in today's webinar. So I hope that the aim is that we will be able to answer the questions that you have on your interest in submitting a proposal for this RFP. And if there are remaining questions that are not answered after this 1-hour webinar, of course, you will be free to send those questions after the webinar. So my name is Christina Osberg. I'm the Director of Science with ICARS, and we are very delighted to release this RFP and of course looking forward to a lot of interesting and qualified applications. So with that, Sunday, I kindly ask you to share the presentation and let's get started on this webinar. Okay, so for those of you that are not familiar with ICARS, the International Center for Antimicrobial Resistance Solutions, we have the headquarters based in Denmark, Copenhagen, and the mission of ICARS is to partner with low and middle income countries to reduce antimicrobial resistance using a One Health approach. We were funded in 2018 by the government of Denmark, in the dialogue with the World Bank, and we now have more than 40 staff members with more than 20 different nationalities. So the approach of ICARS is slightly different from many other donors because we provide both funding and technical support to government and research institutions for testing interventions with the aim of mitigating antimicrobial resistance. We are involved in most of the projects that we are funding in co-creating and co-developing solutions that are evidence-based that can support the implementation of national action plans and AMR in countries. And the focus of our work is really to bridge the gap between policy and practices by testing solutions in real life setting, learning from that, what works on the ground in that specific context, and then take the learnings into inform policies, legislation, and practice in country. Next slide, please. The core of ICARS is to do intervention and implementation research. You will see that this RFP is slightly different from most of our projects, since it's these projects we're calling for with this RFP are shorter duration projects that don't really allow for the full intervention implementation research model. But just to give you a flavor of what we do in most of the project is that we apply very strong intervention implementation research framework to really test what works on the ground. So what's specific for intervention and implementation research is that it's driven by the demand. So the interventions that are tested are driven by what are the research questions, what is the evidence that is really needed by governments to make informed policies. That is building upon testing things in the actual local contexts. So interventions are then designed to be very context specific for that setting, for that country. And as I said before, it's focusing on real world and real time settings. So what are the bottlenecks and enablers for these interventions in that specific section? And what is needed to make these interventions scalable and more successful. Assessing the interventions in terms of their effectiveness in reducing antimicrobial use, addressing antimicrobial resistance, but also what is the impact of the interventions in terms of economics, like the cost efficiency, and behavior change, feasibility, acceptability, and so on. This, of course, requires a very multidisciplinary research team that can assess the intervention from many different angles, but also that you have an involvement of different types of stakeholders, such as researchers, central level authorities, subnational level authorities, NGOs, associations, and so on. Next slide, please. ICARS currently is supporting 55 projects in 24 different countries and territories. We apply a strong One Health approach. So we have some projects that are multi-sector in the way they are designed from start, which is also the case for these RFPs. This is addressing both the animal sector and the environmental sector. Then we have some projects that are more specific to animal health, to human health, or to environmental health. You will see in this map that we have projects up and running in Latin America, the Caribbean, in Africa, in Eastern Europe, in Central, South, and Southeast Asia. Next slide, please. Now, when we look specifically at the interlinkages between antimicrobial resistance and climate change, there is some knowledge out there already, and we are just about to finalize a scoping study to capture and compile all this data together, specific for livestock and aquaculture. And of course, that has informed us in the design of this request for proposal that is released. We know that high temperatures have a high impact on changing the pathogen epidemiology in both terrestrial and aquatic animal husbandry. So heat stress is reducing the immunity, putting a lot of pressure on animals. We also see, for example, changes in vectors and so on, which has high impact on the epidemiology and transmission of infectious diseases. We see that extreme weather events, such as flooding and drought and uncertainty and changes in weather pattern, have a high impact on diseases as well. Of course, it releases antibiotic-resistant pathogens and genes into the environment through, for example, animal waste. There is a re-emergence of infectious diseases with the flooding and drought, changing once again patterns, changing movement of animals and so on. But there are also changes in the microbiology in the ecosystems, both in soil and in aquatic systems. And we see that there is a change in pathogens and resistance in the aquaculture sector. The climate change-induced changes are also contributing to displacement of populations, where people have to move out from normal areas. Grazing of animals is shifting to new areas. Urbanization is change, and that displacement and change of pattern in behavior, bringing animals and humans closer together, is also contributing a lot to the transmission of drug-resistant pathogens. Next slide, please. So we need to take a more holistic approach and not treat the mitigation and adaptation to climate change and AMR mitigation as siloed events, but try to understand the interlinkages between the to, and how we can use resources more efficient to duly address climate change and antimicrobial resistance. And so what was needed there? Well, we did need to build capacity for what the linkages are between climate change and AMR, but also what can you do? What are the most successful actions that can actually bring together climate change, adaptation, mitigation, and AMR mitigation? There's a need for more data on the actual, so quantification. So what is the actual impact, let's say, of climate change on AMR, and the other way around? We need to bring the public and private partners together to really develop new technologies, new innovations, and test them together with farmers to see what works and where could we have the greatest impact, and have the greatest efficiency in bringing together climate smart and AMR smart practices. For that, there's a need to do more implementation research to really see what works in the actual settings in low and middle income countries. But also, there's a need to look more into the institutional changes, the policies, and how do we ensure that there's coordination between the players working on the climate change and on AMR mitigation. What is needed to have stronger interlinked policies and better infrastructures in place, and how do we ensure that capacity is raised and strengthened to understand the linkages and the need to collaborate in addressing climate change and AMR. Of course, also generating the political commitment to join forces together. And this has also been highlighted by the Global Action Group on antimicrobial resistance, that we need really to understand these linkages and bring it together for much more efficient use of resources. Next slide, please. This RFP is released within a larger project that is focusing on solutions for integrating AMR into global challenges. I will not go into the details, but it has two streams. One is focusing on integrating gender and equity into AMR intervention and implementation research. The other stream is focusing on climate change and AMR. And then there is one stream that is trying to link these two streams together. But I will explain more in the next slide on the climate change one. So the whole project is a collaboration between ICARS, with funding coming from the Department of Health and Social Care, with a Global AMR Innovation Fund from the UK. That funding is going to the Canadian the Canadian IDRC and their Innovate 2.0 program, and then flowing to ICARS. So there are many players involved in this project. But specific for the climate change stream, the aim is to document knowledge and identify implementation gaps at the AMR and climate change interface, with a focus on livestock and aquaculture sectors in low and middle income countries. There are possibilities to join the community of action. Some of you have joined this webinar since you're already part of this community of action. If you're not already part of the community of action, please feel free to scan the QR code here and sign up. So the expected deliverables from the climate change stream within this project is to create hotspot map that show where do we have intersects of climate change, increases in antimicrobial use and antimicrobial resistance in livestock and aquaculture. It's to do a scoping review on the LMIC knowledge and implementation gaps for integrating AMR and climate change into practices and policies. That scoping review is underway. Most of the research has been undertaken, and we expect a publication to be released later this year on the results from this scoping review. Then the third one is the reason why you are here now, and those are the country research projects to showcase collaborative AMR and climate smart measures across the food chain. And a final output from the project will be resource material on the interconnected AMR and climate smart research and interventions that can help researchers and practitioners in integrating climate change or climate smart livestock and aquaculture production with AMR mitigation. building upon the learnings we've done throughout the project, including the hotspot maps, the scoping review, and these country projects that you are here for now that will be part of the RFP. With that, I hand it over to Sunday to continue giving you some insights into this specific RFP.
Thank you so much, Christina, for brilliantly putting all of this together and stressing the interconnectedness between climate change and AMR. And just to further stress on the fact that antimicrobial resistance is among the most urgent global and One Health challenges of our time, with an estimated about 39.1 million deaths attributable to antimicrobial resistance by 2050. And climate change is impacting human health, animal health, food and plant and environment as well in so many ways that we can imagine, and many of which also contribute to the emergence of AMR. And the interlinkage between climate change and climate hazards, infection spread, and AMR are emerging and very complex. And despite the well-established connection, like you have seen, which I'll also buttress based on Christina's presentation, you will realize that the evidence base specifically connecting these climate factors to antimicrobial resistance is still relatively limited. And this is particularly true, especially for livestock and aquaculture systems, and even much more specifically and much more useful to consider in low and middle income countries, where we will say the dual threat of increasing AMR and climate hazards could have significant impact on not just food security, but also SDGs that focus or border more around poverty and food security. And talking about the interconnectedness, we have seen from Christina's presentation that climate hazards will have impact on disease burden, and this will actually lead to more antimicrobial use. And also based on the understanding that we have already and based on literature, we will see that South Asia, Southeast Asia, and small island developing states are the most hit when it comes to climate change. But interestingly, as they form part of the low and middle income countries, they are also impacted by the impact of AMR. And this is even much more relevant when it comes to livestock and aquaculture sectors, because rising production plus increasing greenhouse gas emission and increasing antimicrobial use are posing significant threat to climate change, but also to antimicrobial resistance. And with the increase in the growth of the aquaculture sector, and also with the increased demand for antimicrobial use and consumption, you will realize that these are things that actually contribute to climate stresses. And that is why, particularly for this request for proposal, we are seeking to fund what we call small-scale action research studies that will be able to integrate and measure climate change mitigation or an adaptation strategies with reduced antimicrobial use, but also AMR mitigation measures within the livestock and aquaculture systems, specifically targeting low and middle income countries in Asia and the Pacific. And this is already building on the background context that Christina has provided. This RFP aims to support research that identifies, that measures, that evaluates very practical solutions that simultaneously address the dual threats and challenges of antimicrobial resistance and climate change, but also the research should be able to focus on testing and evaluating evidence-based approaches. And I'm putting a lot of emphasis on evidence-based because we need to inform policy, and to inform policy, you need evidence. And we need approaches that can be implemented in resource or low resource settings where these challenges are most acute and most pressing. And just to give you an idea of the scope of this request for proposal, the research studies will be conducted or expected to be conducted in Asia and the Pacific region, with preference for projects in high-risk areas where climate change impacts and antimicrobial use in food production systems overlap. And the projects can be either at a country or multi-country level, as has been mentioned in the request for proposal document, or it can even be more of a regional project if the situations allow for that. And because of the background that I have provided earlier, we are also limiting the scope of the research to focus particularly on production systems, targeting aquaculture and livestock systems. So the proposal can actually comprise of either a project on livestock or a project on aquaculture or both. And though this is probably the right region to focus on, we also expect that the intention is not to exclude other regions, but to limit it based on the literature that is already available. And also to say that in the course of this call, we are aiming to fund up to 4 projects that will be able to address these specific needs in these specific sectors. And the duration for this project is set for 9 months. And we hope that all the work will be able to be delivered within these 9 months. And this deadline is quite a very hard one, if I may say. And also the budget for this can be up to a maximum of $100,000 per project. And what are some of the priority areas? We hope that the interventions that will be proposed in the documents or proposals that we will receive will focus on livestock or aquaculture production that simultaneously quantify through measurements the reduction of antimicrobial use and also greenhouse gas emission. But we also want it to focus on livestock or aquaculture production that simultaneously reduce the use of antimicrobials, but also improve climate change resilience. And also, we want to see a level of adaptation strategies in livestock and aquaculture farming that address changing disease patterns due to climate change, but also systematic and systemic approaches for integrating AMR and climate smart initiatives at either farm or local or national levels. And we want a proposal to be able to demonstrate business or financial models that demonstrate the dual benefit or purpose of addressing both AMR and climate change simultaneously. And also we want the proposals to be able to demonstrate how enabling policy environment for integrating AMR and climate smart initiatives and farm levels or local levels can be fostered. What are some of the expected deliverables? We expect that the proposals or the projects should be able to provide comprehensive description of the baseline situation. This is not to give a very detailed baseline survey, but at least to give a description of the baseline situation within the country. But also we expect that there should be an intervention implementation aspect, not in the real sense of it, as Christina has mentioned, but there should be some documentation, quantification, and measurements of the process and outcomes of implementing and evaluating climate smart AMR interventions that include the enablers and barriers to full implementation. And we also expect that the project should be able to provide evidence on the quantitative and qualitative aspect on the effectiveness and feasibility and as well as sustainability of interventions that address both AMR and climate change in selected production systems targeting, of course, livestock and aquaculture. And we also expect to see some economic analyses that show economic evaluation of the implemented interventions, including potential economic benefits and also barriers to uptake and scale up. And we want practical recommendations for policymakers, producers, and other stakeholders on implementing and also scaling climate smart approaches to AMR mitigation that are tailored and very context specific. And we also, at the end of this, want to be able to have some materials that are developed for different stakeholder groups to facilitate knowledge translation and implementation of findings. And also, we expect to see quite a robust and comprehensive dissemination plan for research findings to relevant stakeholders that are fit for purpose at local, national, and international levels, but also dissemination outputs can include, but we are not limiting it to, let's say, for example, case studies in multimedia format, guidelines, handbooks, even curriculums, policy briefs, and educational materials that could be developed. And some of the methodologies that we encourage, but we are not limiting to, is that there should be an aspect of participatory research approaches that engage stakeholders, farmers, veterinarians, policymakers, and all the relevant stakeholders that will be needed for this throughout the entire research process. And we expect to also see some mixed methods such as quantitative and qualitative methods that capture antimicrobial use, climate metrics, as well as production outcomes. But we also want to see some parameters and metrics around environmental assessments, and also to be able to demonstrate an aspect of behavioral and policy studies to show the need for acceptability, sustainability, and scale up. And also we expect to see an area or aspect of One Health and interdisciplinarity across the project. Now, who can apply for this? We expect that the lead applicant or lead institution must be based in a low and middle income country as defined by OEDC DAC list 2024-2025 effective. And also that this is open to a consortia, but then the lead must be legal entity and within a region that is based in, that is a low and middle income country. And also to mention that even though this can be a consortia, but the funding must go to just one lead institution, and that lead institution should have the ability and the wherewithal to be able to disburse funds to all consortium members. And also to say that here, the proposal can also include subject matter experts, and other experts can be subcontracted, but this will account for not more than 10% of funding that will go to high income countries. And also to mention that institutions that will apply for this must meet all the financial and ethical compliance as stated in detail in the financial aspect of the request for proposal. The proposals that we hope to receive, we aim that they will be evaluated based on first, the relevance to the dual AMR climate goals and the dual solutions that will be proposed and interventions that will be proposed as well. And also the proposals will be evaluated based on the soundness of the methodologies that are put forward, and also the composition of the team and the ability of the team to be able to deliver on the methodologies. So this will also look at also the composition of the core theme, but also we would like to see clear deliverables that align with the timeline, that align with the delivery methodologies, and also the relevance that will be put forward as part of the proposal. And also we want to see a very feasible and yet efficient budget that is able to deliver on all the objectives of the proposal. And also, most importantly, is to see the ability of the institution to demonstrate the potential for scale up and sustainability of interventions and recommendations that will be put forward as a result of this work. Some very important things to take into account in the process of formulating this proposal is to say that the proposal should not be more than 10 pages, which includes also the annexes. And as part of the submission, please ensure that you submit the budget, the Gantt chart, the CVs using the template that has been provided, and also audited reports and standard operating procedures for financial management of the potential grant recipients. And also we encourage you please to use the ICARS templates as proposals submitted. Not using this template might not be considered. And we have a very hard deadline for the proposals, and this is the 30th of June. So we have a little over a month for you to be able to come up with a good proposal. And please, every question that might not be answered here, or if you need any clarification in the course of the proposal development, feel free to reach out to us through this email. And just some key dates to remember is that this RFP was launched on the 15th of May 2025. And like I mentioned, the deadline remains the 30th of June. And we expect that the application review will be complete by the 31st of July 2025, with the aim that the project start date will be the 1st of September 2025, and the expected end date of the project will be 30th June 2026. And just for a recap, we expect that in summary that we are looking for a small scale action research studies that will be able to integrate climate change mitigation and adaptation strategies, but as well as reduce antimicrobial use and potentially antimicrobial resistance. And this should focus on livestock and aquaculture systems in low and middle income countries, particularly targeting Asia and the Pacific region. But also we hope that the proposals that you put forward will be able to show and provide measurable and practical solutions on how best to mitigate the dual effect or dual threats of climate change and antimicrobial resistance. Thank you so much for listening. And with this, I open up for questions.
We have a question from Lillian, so maybe I'll allow her to talk.
Yes, please.
So she can let us know.
Go ahead, Lillian. You're muted.
Lillian, you're currently muted, but you should be able to unmute yourself. If you're still having problems, you can also use the Q&A option to write your question there.
So while we're waiting for Lillian to unmute, I can just address one comment that has been, or several comments, I would say, and questions in the Q&A function. It's about countries that are eligible to apply. So any country that is within the Asia and the Pacific region that is on the dark list of ODA recipients is eligible for this call. You can see in the Q&A function that I responded to these questions by adding also the dark list of ODA recipients from the OECD. So please refer to that list if you're not sure that the country that you want to submit an application from is eligible.
Thank you, Christina. I can see a question in the chat asking about if the presentation will be shared. Yes, the recording of this webinar will be shared to all registered participants, and in it will contain the presentation, of course. Okay, I see Lillian is still unable to unmute.
I can then take another question that was posted in the chat about airborne AMR. Since we didn't mention airborne AMR, I already responded in the Q&A function here, but of course airborne AMR is also eligible. We have just mentioned water and soil in the presentation, but it doesn't exclude airborne AMR.
Hello, I'm finally
Yes, Lillian, go
unmuted.
ahead.
Yes, hi, good day, everyone. Thank you for the information that you shared. I have a question. Like, I understand that per project, the fund is about $100,000. Would it be possible that for each, like for a certain agency, government agency, will submit various projects, or just one project per agency?
Okay, preferably an agency should submit one proposal, and we expect that that should be a prioritized proposal coming from that agency. But should there be different sections in the agency that feel the need, or they feel they have different interventions they want to test across different production systems, for example, feel free to submit an application, but I think it is recommended that an agency should prioritize one proposal to submit.
Okay, thank you.
You're welcome,
That's
Lillian.
Thank you.
Okay, I can see quite a number of questions around asking if, for example, Mongolia or India is considered. And I see Christina has responded. So every country that is within the Asia and the Pacific region that falls in the dark list of ADA are eligible to apply.
There's another question in the Q&A function about the interaction between livestock and human, so that the livestock-human interface, saying that it's a significant concern, antimicrobial resistance at the livestock-human interface due to the shared use of antibiotics and the potential for bacteria to spread between populations. The person is asking if we can include human AMR factor with livestock, or if it's just limited to livestock AMR. The focus on this call is on livestock or aquaculture and climate smart production. So of course, any human health interlinkages can be highlighted or shared as part of it, as long as the focus is on the livestock or I would say aquaculture production. Then if there is bandwidth to showcase how this impacts human health, I mean, that is just a benefit. Please add to that, Sunday, as well.
Thank you, Christina. You've answered that very well. Okay, I see another question around why are the ICARS projects not found in North America and Western Europe? What ICARS seeks to address cuts across with impacts, especially. So like we mentioned, we work specifically in low and middle income countries, and the way ICARS works generally is not by research for requests for proposals, is mostly through expression of interest from governments and agencies and institutions in low and middle income countries. So if there are countries that ICARS is currently not working in, it could be that we have not received an expression of interest in that. But to also emphasize the fact that mostly or largely we work in low and middle income countries, irrespective of region. And also I see here, okay, yeah, it's just talking about the need to broaden ICARS reach. Do you want to add to that, Christina?
Just to say that the funding we receive in ICARS is earmarked for low and middle income countries, those countries that are on the DAC list of ODA recipients. So we can't possibly fund high income country proposals. So that's the limitation that we're having. For this specific call, it is earmarked for Asia and the Pacific, although you will see that ICARS is otherwise working across low and middle income countries across different continents. So for those of you that are here from countries that are not eligible for this RFP, I really advise that you go to the ICARS website and check what opportunities there are to send an expression of interest for a project, because that is open to all low and middle income countries. And I think what we can do, we can put a link to that in the chat here so that you can follow that one. So if you're not eligible for this specific RFP, there are a lot of other opportunities for you. I want to stress that.
Thank you so much, Christina, for that. And we have a question from Atur Rahman asking if the lead academic or research institution should be from Asia or can be from Europe and co-applicant from Asia. I think it's important to note that the lead applicant must be based in low and middle income country in the Asia and the Pacific. You can have a co-applicant from, say, for example, Europe, but like we mentioned, subject matter experts or experts from high income countries are only allowed about 10% of the total budget. So please take note of this, but the lead applicant must be based in low and middle income country in Asia and the Pacific. With this, I also want to respond to a question from Dina. The question says, do you have restriction to the expertise of the institution and to the institution applicant? Is institution expertise in only human health eligible? So here we would like to say that all the expertise that will be needed to deliver on a climate change AMR research in livestock and aquaculture systems are encouraged and are expected. We do not restrict expertise, but we want to ensure that the needed expertise are in place when the proposal is submitted. So if the only human health institution has this expertise to be able to deliver on that, it's fine for you to submit an application, but then you should be able to demonstrate that you have the needed expertise to deliver on a proposal that has to do with climate change AMR in livestock and aquaculture systems. Do you want to add to that, Christina?
No, and I can actually respond addressing the next question as well.
Okay.
If a group of consultants can apply, so they can be a consortium that includes ministry, researchers, and also consultants that you're bringing in that provide additional expertise that you need to implement the project. So it's quite flexible there, as long as it's not a for-profit institution or organization. So you will see that detailed in the request for proposal. Non-profit organizations are not eligible to receive funding. Otherwise, it's very flexible. If it's a ministry or government agency, if it's a research institution, if it's a consortium of different types of institutions. Yeah, just to address several questions coming on who is eligible there.
Thank you so much, Christina. And also just to add to that is a question asking if the lead must be government ministry or non-government agency. So it can be both, but it must be an institution that has the ability to deliver on the research aspect of it. So it could be a government agency or it could be a research institute based in a low and middle income country. But then the institution must be able to deliver on all the expected outcomes and deliverables of the project. Also here we see is this specific call, how many, or in this specific call, how many research proposal will be selected. As we mentioned in the course of the presentation, we'll be able to support up to 4 research projects with a maximum of $100,000 each for per project. Thank you. And I see here a question asking if Egypt is included. So Egypt falls under Africa and not specifically in Asia and the Pacific region. So with this, unfortunately, you can go on our website and be able to apply through the normal expression of interest. if this is an area that you want to explore. Okay, there is a request here if we could share the link for expression of interest from ICARS website. My colleagues will drop that in the chat, and we hope that will be useful. Okay. Just checking to make sure we have not missed any question. Celia, can you confirm if all the questions that were dropped in the chat have been addressed?
Yes, all the questions in the chat and in the Q&A have been answered.
Okay, and we have a new question coming in from in the Q&A asking if PhD students with relevant ideas qualify. So as a PhD student, you can apply provided you are part of an institution that has the capacity to deliver on that, but then you as an individual cannot apply. It has to be the institution that applies. So you can form part of the team, you can form part of the research institute, but then it's an institution that has to apply for this. I hope that has been answered. Okay, with this, we still have 11 minutes before the end of this call. And I would like to say that it has been quite a very useful and engaging moment, and also to see all the interest that have been expressed through all the questions. It demonstrates the willingness and the genuineness of you trying to apply and to see how you can mitigate the dual effect of climate change and AMR. With this, I would like to ask if Christina has any closing words or comments.
We just to say that we are humbled by the high interest in this call, and that we're really looking forward to receive high quality applications. And we will of course read and look closely into each and every application received. Please note the deadline of sending the application. And Vanessa has now also kindly put the link to the application in the chat. So you will see that one, 30 June, 11:59 p.m. Central European Time is deadline for submitting an application to this request for proposal. And if you have any questions regarding the application, you will find the email where you can submit your questions as part of the request for proposal link that Vanessa has kindly shared in the chat. So if there are questions that you forgot to answer here, please refer to the email in that request for proposal link, and feel free to share, send any questions to us. We really encourage you to sign up to become part of the community of action. I shared the QR code in the presentation here, if you're not already part of that, because we will start activating this community of action and share results coming out from our different projects and initiatives. And so we hope to be able to stay engaged with most of you. And I see also here Celia shared in the chat as well the opportunity to sign up for the community of action. With that, I would like to express sincere thanks to all of you for joining, and we're really looking forward to receive your applications for this request for proposal. Thank you.
Thank you so much, Christina. And I would like to use this opportunity to also thank the ICARS colleagues, Celia and Vanessa, for doing all the background work to make sure that everything is going smoothly, and everything went smoothly. And also a very big thanks to all of you that signed up and joined, and to also encourage that please feel free to share this opportunity to other colleagues and other people that you think will also benefit from this opportunity. With this, we've come to the end of this webinar, and we would like to say a big thank you and thank you and thank you. And please Whenever you see ICARS calling for a webinar again, or whenever you hear the name ICARS, always jump onto the opportunity, and it will be a great opportunity to connect with you once more. Thank you so much, everybody. And please, should you have any further question, remember we are available on our emails. I just saw a hand popped up. Mahmoud. Okay, he's just saying thank you. All right. Thank you, everybody, and please have a good weekend ahead. Bye.
Thank you. Bye.